Possible heart attack. You arrive on scene to a well-kept farmhouse. Fire department on scene. The husband greets you and escorts you to the patient. The patient is currently conscious, alert, and in severe distress on the floor, clutching your chest and crying.
Just like that?
Yeah, just like that.
Cool. Okay, so PSI is my scene, right?
Yes.
Okay. Is my partner EMT or paramedic?
Go paramedic.
Cool. Hello, ma'am. My name is Arcadia. This is my partner Aiden. We're from the ambulance. What's going on today?
My chest hurts really bad.
Where does it hurt on your chest?
Right in the middle.
Can you describe the pain to me?
It's like a squeezing pain, like right in the middle of my chest.
Okay. What would you rate the pain out of 10?
10.
Okay. Does she have a radial pulse?
Yes.
She's talking to me, so she is alert. Do I see any signs of difficulty breathing or labored breathing?
A little bit of difficulty breathing.
Okay. Is it shallow, labored?
Shallow and rapid.
Shallow, rapid. Okay. She does have a radial pulse?
Yes.
Okay. Is it fast or slow or regular?
Regular. Strong.
Okay.
For a rate?
Yeah.
96.
Okay.
Yeah.
Okay, so given her symptoms, I am suspicious for a heart attack. I'm going to have my partner go ahead and throw her on the 4-lead first while I get more history. Okay, ma'am, do you have any cardiac history?
Not that I know of.
BP and SpO2 and stuff.
Do you have any history of, yes please, diabetes, heart attacks, lung problems?
Not that I know of.
Do you take any medications for anything?
I take Tagamet and Prozac.
Okay, I am not familiar with the first one. Do you know what you take that for?
I have an ulcer, and I think it's like help with my ulcer in some way.
Okay. Alright, so.
Alright, so we have her on the 4-lead with SpO2 and blood pressure cycling.
What are my vital signs? Blood pressure?
136 over 84.
Okay. What is her SpO2?
94.
What is the 4-lead show?
Sinus.
Okay, we're gonna do a 12-lead now.
You have to put the stickers on? It's on the
So what are her skin signs?
so it's a feel warm dry.
They feel warm and
Yeah.
okay. You've been eating and drinking normally.
Yeah, I just finished making or eating breakfast.
Okay. Have you been peeing and pooping normally?
Yep.
Do you have any allergies to medication or anything else?
I'm allergic to morphine and aspirin.
That's good to know. What is your allergy to aspirin? What happens?
I'm just not supposed to take it because I have an ulcer. My doctor said I shouldn't take aspirin.
Okay, what is your allergy to morphine?
My lips get all swollen and tingly.
Good. So, I know that you say that you have an allergy to aspirin and you are not supposed to take it, but I'm going to give you 3 days of aspirin right now for your chest pain. 1 dose is not really what your doctor is talking about.
Okay, whatever you say, I trust you.
So, going to hand her 4 aspirin. Please chew those up really well and swallow them. Okay, so we have a 12-lead on. What am I seeing? All right, so I am going to interpret that as a
Elevation in 1.
STEMI.
ABL. And then 1 through 6.
Interlateral based on.
So we get the opposite lateral and anterior. Go to the circumference along the interior.
Okay. having a STEMI. This is a critical patient. We need to get her loaded up and go to the nearest cardiac center, which is how far away?
14 minutes.
Okay. All right, so we're gonna bring the gurney right up next to her. We're gonna pick her up because I don't want her standing right now. We're gonna place her on the gurney, get the gurney loaded up into the ambulance, and we are in the ambulance. And I'm going to take. Do I have fire on scene?
Yes.
Cool. I'm gonna take fire rider.
Sounds great.
Fire rider. Cool. All right. So now that we're in the ambulance, I'm gonna recycle my blood pressure. What is my new blood pressure?
136/84.
Okay. I'm going to give her 1 spray of nitro sublingually.
Okay.
Does that have any effect on her pain?
Well, she says her head hurts now.
Okay. I'm gonna go ahead and have my partner start an IV. And I'm gonna get fluids prepped. Gonna listen to some lung sounds. Deep breath in, deep breath in and out.
Please
Deep
leave my
breath in and
line.
out. Inhale. What is your pain scale right now?
10.
Still a 10, still same area?
Yep.
Does the pain radiate anywhere?
Yeah, it feels like it's moving down my arms and into my neck.
Okay. Couple of silly questions. What is
Yeah.
your name and date of birth?
My name is Gertrude, and my birthday is 123, whatever makes me 64 years old.
Okay. Do you know where we are right now?
We're in the ambulance.
And do you know what day of the week it is?
Saturday.
And do you know who the president is?
I did.
Okay. Have you ever been given a medication called fentanyl?
I have not.
Are they even 18 in the red AC?
Okay, so I'm gonna have my partner doing fluids. And then
You want these just open?
yes. I am going to check the EG. Are you nauseous at all, ma'am?
I'm a little nauseous, yeah.
Okay, so gonna give oral Zofran. Alright, I have an IV. I'm gonna give IV Zofran. So Gertrude, you said your name was?
Yes.
We're gonna be giving you some medications for nausea to hopefully help with that. And then I'm gonna give you a little bit of pain medication. I'm not giving you morphine because you said that you were allergic to that. And we're taking you to St. Joe's, which is the nearest cardiac center. I believe you are suffering from a heart attack right now. We're gonna get you to the hospital as fast as we safely can and get you taken care of. So I'm gonna give the Zofran first. I have 4 milligrams and 2 mLs. I'm gonna give 4 milligrams IV, which is gonna be the 2 mLs.
No, I just flushed it with the line.
Oh, right, fair. Alright,
And we just-
I don't have any information. So, and then I'm going to give her a dose of fentanyl. So it's 50 micrograms in ml. I'm gonna start with 50.
So you're
50
50
micrograms.
micrograms for 1 milliliter.
Alright, ma'am, is your pain changing at all?
No, it still hurts.
Okay. Can we get her on oxygen?
You want to just stay looking at
Let's
What's she setting at?
94.
Let's do, high flow for, yes, let's do high flow oxygen at 10 liters per minute on, a non-rebreather mask. I'm gonna check the BG. Oh, thingy.
101.
Cool. And how far are we away from the hospital?
8 minutes.
Alright. I'm gonna go ahead and call the hospital now just to give them a heads up. St. Joe's, City 1, Code 3 Medical.
St. Joe, go ahead.
St. Joe's, this is paramedic Arcadia on City 1 coming to you with a Code 3 Medical on board. I have a, right, how old is she?
54.
64. Continuing on board, I have a 64-year-old female today suffering from 10-on-10 substernal chest pain. 12 lead is positive for anterolateral STEMI. I would advise activating the cath lab. I will transmit EKG. She has 324 milligrams of aspirin on board. She's been given 50 micrograms of fentanyl for pain control. She is on high flow O2. The fluid's running. We are ALS for STEMI, and we'll be at your facility in 7 minutes.
No questions before see you in 7.
Great. Okay, so I'm gonna reassess vital signs. What is my blood pressure?
136/84.
And heart rate?
96.
How is her breathing now with the oxygen?
Shallow and rapid.
Okay. Heart rate, do you have any?
Oh, you try another nitro if she still has pain.
Yeah. Alright, I will try another sublingual nitro.
Now my head hurts again.
Keep doing that. And that fentanyl didn't touch your pain at all?
Nope.
Okay. So I'm gonna keep talking to my patient and ask her questions. She lives on a farm. What kind of, I don't know. What kind of farm do you have?
I just kind of homestead with my husband.
Oh, that's pretty cool. How long have you been doing that?
Since I was like 30.
That's a long time. Do you mostly live off the grid?
Pretty much. We just kind of go into town for some things that we can't make on our own. And, you know, maintaining of our equipment and stuff.
That's pretty neat. When's the last time you saw a doctor?
Probably like 2 months ago.
Was everything normal and good back then?
Yeah, it was just because my stomach hurt because of an ulcer. So he, I was taking baby aspirin before that, and he told me to stop.
Okay. Besides the ulcer, have you had any bleeding problems?
Nope.
Do you want to put it on the pads, just in case?
Why not? Sure. What is our ETA for the hospital?
4 minutes.
Alright. So it hasn't been 5 minutes since my last vital, so I'm just gonna continue. How are our fluids doing?
Are you giving fluids?
Yes, we've been giving fluids.
Okay.
How many have gone in?
Is it wide open?
Has gone in? It is wide open, yes.
I don't know, it's been 300 milliliters gone in?
Cool. Has her breathing improved at all on the oxygen?
What do you mean by improved?
Is it, less rapid?
Nope, still rapid.
What
Still
is
shallow.
my respiratory rate?
22.
Ma'am, are you taking shallow breaths because of the pain? Does deep breath,
Your lungs sound
deep
still clear?
breaths? Make it
Both,
worse.
it feels like I'm having trouble catching my breath, but it also just really hurts.
Okay. And you said you have no history of lung problems, no recent pneumonias or anything like that?
Nope.
Okay. Alright, when we get to the hospital, things are gonna move very quickly. They're gonna do another, actually, can I do a second 12 lead just to make sure
Yeah.
things are,
I think you guys still have it?
Yeah.
is it same?
Yep, same.
Okay. Okay, so when you get to the hospital, things are gonna move very quickly. As I said, I think that you're suffering from a heart attack. They're going to do another EKG as soon as we get there, and then possibly whisk you away into the cath lab. Everybody will explain everything when you get there. I just want you to be prepared for that. Aiden, do you have anything to add?
Doesn't look like anything's touching your pain at all.
Recycle my blood pressure.
We check the BD?
A BG.
You did.
I did a BG, yes I did. Can I recycle my blood pressure?
136/84.
Cool, glad that's holding steady. Okay, I'm gonna do an additional 25 micrograms of fentanyl since she's still in 10/10 pain and we want to try to fix that. I have 50 micrograms per milliliter, so I'm going to give half a milliliter. Fentanyl again. Is there any change in your pain level, ma'am?
No, it still hurts.
Okay. Was there ETA for the hospital?
30 seconds.
Alright, ma'am, we're gonna be arriving at the hospital here. Like I said, everything's gonna move very quickly, but they're gonna take very good care of you.
You a signature?
Can I have you sign this iPad?
Yeah. I sound like my fingernail, right?
Just the pad, ma'am, just the pad.
Beep, 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 beep. Oh, the ambulance is back to the bay and the doors are open and we whisk you away to the cath lab. Yay!